everyone. My name is Dr. Doris Grinspun, and I'm the CEO of RNAO, the Registered Nurses Association of Ontario. I want to welcome you to the second annual presentation of the Nursing Now Ontario Awards. Ontario's nursing associations, RNAO, ONA, the Ontario Nurses Association, and WeRPN, Registered Practical Nurses Association of Ontario, decided to establish, with permission from Nursing Now International, the Nursing Now Ontario Awards last year. You may remember last year was coined by WHO as the Year of the Nurse. I think for us, every year is Year of the Nurse. So we maintain the Nursing Now Awards, and this is the second year we are honored to provide these awards. They showcase the excellence, and I would add the formidable work that nurses are doing across our awesome province. This award program builds on the goals of the World Health Organization and International Council of Nurses and the Nursing Now campaign, a global initiative aimed at improving health around the world by strengthening nursing. I don't need to tell you that this year we provided in spades the care that we do. I just mentioned to a media today that we thought last year that Florence Nightingale had given us in a silver plate the pandemic to showcase nursing. And today I say she gave it to us, but for a bit too long. To celebrate the contributions made by nurses to their clinical practice and the health and well-being of Ontarians, the Nursing Now Award honors one nurse practitioner, NP, one registered nurse, RN, and one registered practical nurse, RPN. For the second year in a row, Nursing Week falls in the midst of a pandemic. And that's why we're joining again virtually. We wish we were in person, and we certainly hope that for the third Nursing Now Awards, we will be indeed in person. There is light at the end of this long tunnel. Our event purposefully coincides with Nursing Week and purposefully coincides with Florence Nightingale's birthday today, May 12th, the founder of modern nursing. As I just mentioned, we are unable to gather in person. However, let us take a moment to reflect and honor our thousands of nurses, RNs, nurse practitioners, RPNs, who have given their all during this 15 months pandemic. We owe them a debt of gratitude for persevering through a pandemic that seems at times endless. Their knowledge, their expertise, their compassion, and yes, their courage and their stamina to keep going, despite sometimes very, very difficult conditions, not only with with very compromised patients or clients or residents, but actually some difficult conditions in their own work settings. Some of them very supported by the work settings, some of them less, but all in all, that's not what the issue is today. Today is the issue celebrating our colleagues. We know there is light at the end of the tunnel, but we haven't reached the end of this fight yet. And so I ask you to take a moment to reflect on the lives lost, patients, nurses, and other healthcare providers. Let's take a moment to reflect on them. We mark Nursing Week to honor the work of those in our profession, those we lost and those that are here, and the ones that are students and will be nurses in the near future. This ceremony in particular recognizes nurses, a nurse practitioner, an RN, and an RPN, who have contributed to nursing and the health system and the health of Ontarians in very special ways. They improved the quality of life of their patients and contributed to their chosen profession. So let's begin by introducing our awardee presenters. The president of the Registered Nurses Association of Ontario, RNAO, Morgan Hoffarth. She will introduce the nurse practitioner awardee. The president of the Ontario Nurses Association, ONA, Vicki Mckenna. She will introduce the RN awardee. And the CEO of WeRPNs, Dianne Martin, and she will introduce the RPN awardee. They will present each recipient in each category with their virtual award, and they will then give a time for the awardees to share their thoughts. The response for our second annual awards program was phenomenal. We reviewed 213 outstanding nominations. The three associations identified one winner in each category collectively, and we would like to thank the review committee for their important and attentive work and for the many hours that they dedicated to review 213, and let me repeat, 213 outstanding nominations. Don Armstrong, Lori Lopez, and Angela Procanin from ONA, Shannon Foster, Samantha Salatino, Norma Tomlin, and Annette Weirs from WeRPNs, and from RNAO, Heather McConnell, Julie Ravel, and Maria Ragg, and Michael Scarcello. They represented RNAO in the selection of the awards. RNAO acts as the secretariat for this award program, and so I also want to take a moment to thank the tremendous work and hours of dedication of Heather McConnell, Marianne Zich, Alicia Sanders, Olga Gabriela, and Erica De Souza in coordinating all the logistics, designing work, promotion, and communications. Thank you, colleagues, to both those representatives of ONA, the representatives of WeRPN, and our own team at RNAO. At this time, I would like to invite President Morgan Hoffarth, the president of RNAO, to present the nurse practitioner recipient of the Nursing Now Ontario Awards. Morgan.
Thanks, Doris. It's an absolute pleasure to be here with you today during Nursing Week to acknowledge the contribution of nurses to the health and well-being of Ontarians. It's also a privilege to hand out the award for nurse practitioner because as president of RNAO, I know how hard the association has worked to advocate on behalf of NPs. We know the value of this role in our health system. RNAO issued a report this past spring called Vision for Tomorrow with recommendations on how to increase the number of NPs and expand their scope of practice. They are crucial to our health system and they are making a difference, especially among vulnerable populations and at-risk communities. Our award winner is Aric Rankin, a primary care nurse practitioner who works at Des Droits des Nez Aboriginal Health Center in Hamilton. His interest in working with Indigenous communities was first sparked during a lecture while pursuing his undergraduate nursing degree. The guest speaker was an Indigenous health provider, and he was captivated by her stories and use of Indigenous teachings, medicine, and traditions to bring wellness to the community. Aric went on to work in fly-in communities. It was there that he gained a better understanding of the barriers to care Indigenous communities experienced and the systemic racism Indigenous people face. And it was that experience that led him to continue his education to become a nurse practitioner. His nominator describes him as someone who worked collaboratively with an interprofessional team to develop programming for chronic disease management. He has developed relationships with external Indigenous organizations to ensure he was providing optimal care for his patients and families. And he is active as a mentor and strives to support others in achieving excellence in all nursing domains. Always a lifelong learner, Aric is currently working on his doctoral degree with a focus on Indigenous health, health equity, and health system reform. Aric is also a member of RNAO's NP task force. Aric is proud to call himself an NP and encouraged by the role NPs play in our healthcare system. He knows their numbers should be increased and wants many more Ontarians to benefit from the care of NPs. Aric, it is my pleasure to present you with the Nursing Now Ontario Award in the Nurse Practitioner category. I'd like to invite you to say a few words.
Thank you so much, Morgan. I appreciate it. Good afternoon. It's an incredible, humbling, and distinct honor to have been nominated and to be the recipient of the Nursing Now Ontario Award for the Nurse Practitioner category. I would first like to thank the Ontario Nurses Association, the Registered Nurses Association of Ontario, the Registered Practical Nurses Association of Ontario, or WeRPN, for this distinct honor and the opportunity to celebrate the great work that nurses are doing in Ontario. Furthermore, for the ongoing essential work advocating for the profession of nursing and for the health of Ontarians. I would like to thank the nurse practitioner, Michelle Gentle, who nominated me for this award and who I consider my mentor and a lifelong friend. Most of all, I'd like to thank my family, my folks, for raising me with love, compassion, and empathy, and encouraging me to speak out on social injustices. To my wife, Michelle, for her unwavering support, love, unrelenting patience within my involvement of the nursing profession, and the occasional time that I forget to bring the pots downstairs off the counter. All jokes aside, she's a beautiful soul, and we have 4 absolutely stunning children, no bias there, who cheer for me on each and every day. Mckenna, Connor, Morgan, and Cameron, I love you. As a nurse practitioner, I'm so proud of what my RPN, RN, and NP colleagues are achieving across this province, in this country, and across the world. This is especially evident over the past year and a bit during these trying times of a global pandemic. Thank you to each and every one of you for your selflessness, your dedication, your bravery, as you continue to battle this virus. I'd like to acknowledge those who have died during this fight, their families, and that they may find the strength, the support, and the love that they need during these difficult times. The purpose of the Nursing Now campaign is to raise the profile and status of nursing. Nurse practitioners have worked tirelessly to increase public awareness of the NP role, to advance the NP scope, and address healthcare needs within the communities, particularly those of marginalized and underserviced populations. NPs have been vocal about wage inequity. These are all outlined in the NP task force recommendations. There is much to be done. There remains legislative, policy, and practice changes that are required to remove barriers that impede NP's ability to function to their full scope of practice, as well as address the issues of systemic racism that exist in our healthcare system today. NPs provide the highest standard of care. There's no doubting that. The evidence is there. Let's continue to do our best to make positive change within the profession of nursing and in the healthcare system. We must stand united as RPNs, RNs, nurse practitioners to advocate, continue to do the much needed research, to educate, and to continue to be visible and have a loud voice and provide that highest standard of care. Happy Nursing Week to everyone, and thank you very much for this honor. It is a privilege. I'm grateful.
Thank you, Morgan, for sharing with us your thoughts on the role of NPs and for highlighting aspects of Aric's outstanding practice career. And thank you, Aric, for your expert care and mentorship. We are privileged to have you in the profession, and we are privileged to have you as a very active member of RNAO. We are so proud of you and wish you the very, very best, both in school and in your PhD, and of course with Michelle and your 4 brilliant future nursing kids. So, thank you for sharing your comments about your practice and the population you serve so proudly. We know that the stars are the limit and you're still going to fly high, high, high in serving Indigenous communities. We know that. At this time, I would like to call upon President Vicki Mckenna. She's the president of the Ontario Nurses Association, ONA, to present the award winner for the RN category. Vicki, please.
Thank you, Doris, and good afternoon, everyone. Congratulations, Aric. Well, it is truly a pleasure to be here with all of you this afternoon and to pay tribute to recipients of the Nursing Now Ontario Awards. And I think that we can all agree that nurses, it's been more than a bit of a tough year. It's been the most challenging year most all of us will ever face in our lifetime, let alone in our nursing careers. And nurses have gone above and beyond time and time again to face significant challenges each and every day. The pandemic has highlighted the vital importance of nurses, their dedication to ensure that patients, residents, and clients are healthy and safe. That compassion and the comfort that nurses demonstrate in all sectors in our healthcare system have advanced greatly that the respect that nurses are held by our communities, by the public, by the families that we serve. I am so pleased that we are using this opportunity today to continue to promote and highlight our profession and some amazing nurses. And so it's now my honor to present the Nursing Now Ontario Award in the Registered Nurse category to Mahoganie Hines. Mahoganie has clearly demonstrated outstanding professionalism throughout her career, including in her current role as a pain and symptom management consultant in the Niagara region. She provides palliative and end-of-life care to residents in more than 30 long-term care homes right across that Niagara region. It's her holistic approach, her examining medical, emotional, spiritual, all the factors, and working within a team environment that inspires the dedicated work that she does each and every day. She's a strong leader. She's a mentor to nurses and to all healthcare professionals. She supports education and mentorship throughout her community around palliative care and end-of-life care as an instructor for the comprehensive advanced palliative care education and that education program for RNs and RPNs in community care. She's built many strong relationships within local communities and government officials, working to make sure that the Niagara region is healthy and safe and accessible for all. So at the request of her Member of Parliament, Mahoganie presented the importance of palliative and compassionate care at the first and the final readings of the Compassionate Care Act in Ontario, which reached royal assent last December. She was recognized by her community as the top 40 under 40, a prestigious award that recognizes success in private, public, and not-for-profit sectors. She has been honored for her volunteer and professional work in that Niagara community. And I'll say that the devastating COVID-19 pandemic has had a profound impact on healthcare professionals, including Mahoganie. She says that we're all tired and we are doing the very best that we can with the limited resources that we have. I hope that the pandemic has shined the light on the fractures in our healthcare system and that they can be repaired. Mahoganie, I think we all agree with that statement. And now it is truly my pleasure to present Mahoganie with the Nursing Now Ontario Award. And congratulations, Mahoganie, well deserved.
Thank you so much, Vicki. So I'd like to focus my thank you on gratitude. So thank you, ONA, RNAO, and WeRPN for shining a light on the amazing work nurses have and continue to do across our province to care for our communities and for acknowledging the sacrifices so many of us have made over the last year plus. I'm grateful to be a registered nurse, to be a hospice nurse, and to be a palliative pain and symptom management consultant. I am privileged to do what I love day in and day out, and to help other nurses and healthcare providers ignite their passion in palliative and end-of-life care and advocacy. I would like to express my deep gratitude. I'd like to express my deep gratitude to my family.
Just 1 second, Mahoganie. Someone, can you turn all the mics off, please, guys? Aric, I need you to turn all the mics off of people. Thank you. Okay, Mahoganie, please go ahead.
Thanks, Doris. I would like to express my deep gratitude to my family, my friends, and the calm to my storm, my husband, who they've always helped me to feel supported and encouraged to keep me going and to bring my true self into all I do as a nurse and as a person. Our families, the families of nurses and healthcare providers, are our heroes. They keep us grounded, and they act as continued reminders on how and why we continue to do the work that we continue to do. Lastly, I need to express my gratitude to each and every frontline provider across the nation and the province. This award is as much as ours as it is yours. As we walk through the pandemic together, though in very diverse ways, please remember to keep the love and compassion poured into the work that you continue to do. I see you, and my hope is now that all Ontario sees you and the unrelenting care you bring to some of our most vulnerable. You continue to show up and stand up despite all odds. I see and honor each of you, and I thank you. I am grateful and honored to have been chosen for this award, but I want to be cognizant that there is still much work to be done, and this cannot be the end, but just the beginning. We need to continue to advocate for equity and healthy public policy for all, not for some. We need to continue to elevate the role of nursing and create access to care for all underserviced populations. Please continue to fight for what is right and just, and I am grateful to be able to continue that fight and do the same. Sincerely, I thank you for this award. I am honestly humbled and still shocked. Please stay safe and take care and stay well. Happy Nursing Week.
Bravo, bravo, Mahoganie, so well deserved. Just beautiful, just beautiful. Thank you so very much. Thank you, Vicki, for your comments on the importance role of the RNs, for your introduction of Mahoganie and highlighting the tremendous ways in which she has demonstrated her leadership and role modeling in her specialty area. Mahoganie, to you for just giving us a little bit of yourself and the tremendous work you do for shining the light on all the other nurses in the province and indeed across the country and the world. Thank you for sharing your reflections on your career as an RN. And I know, again, the sky's the limit, much more to come. A heartfelt congratulations from all of us for your outstanding achievements. And yes, I must add, thank you also for being a very active member of RNAO. I would like also to now ask CEO Dianne Martin, she's the Chief Executive Officer of WeRPN, to introduce the winner of the Nursing Now Ontario Award in the Registered Practical Nurses category. Dianne, take it on.
Thank you, Doris. As we celebrate our second nursing week in this pandemic, I'm struck by the amazing resilience and dedication of our nursing community. I often think that the people who choose nursing are unique. And while each of us has our own compelling reason for joining the profession and why we came into the profession, we can all agree that we stay because of the impact we have on the lives around us. Most days we rely on our knowledge and skills, but we also tap into an inner source of strength to get us through the end of a grueling extra shift or a particularly challenging day. Over the past year, nurses have had to tap into that inner strength far too regularly as they have shouldered the enormous pressures that they have faced. Their bodies and minds are exhausted. I want to take a moment to acknowledge all of Ontario's nurses for their courage, perseverance, and sacrifices. You are all an inspiration, and your tremendous work is what will get us to the other side of this pandemic. Today, as we celebrate excellence in nursing, let's acknowledge how many nurses have gone above and beyond this year in truly incredible ways. And it's a pleasure to honor these 3 nurses who have made a noteworthy impact. I want to congratulate the recipients for your amazing contributions. I am especially thrilled to recognize the RPN recipient of the Nursing Now Awards, Sheri Bruder. Sheri works at the Brantford General Hospital in their centralized resource department, where her skills and experience are leveraged in multiple environments within the hospital. As a leader, Sheri is approachable and a true collaborator. She's always willing to help new staff, celebrate individual and collective successes of her coworkers, and she is a mentor and a role model, and that has never been more important than it is now. In a hospital setting where success and positive outcomes are a team effort, Sheri's example of how to work collaboratively with cross-functional units, whether it's the physiotherapist, social worker, or manager, that can make a real difference. And Sheri is a staunch advocate for patients. Her colleagues say that she makes the work environment better for everyone, and she epitomizes the true definition of a nurse. It's an honor to congratulate this year's RPN recipient, Sheri Bruder. Sheri? Do we have Sheri to say a few words?
Hello.
There you go.
Can you hear me? Okay. I must have had it on mute.
Yes.
Can you try to put the camera on, Sheri?
Is that working?
Bravo.
Oh, good. Well, thank you, Dianne. And thank you, Nursing Now Ontario Awards. It's truly an honor, and I'm humbled to have been nominated and selected to be this year's winner for the RPN group. I work hard every day representing the RPN and our scope of practice, and to provide the best possible outcomes for our patients. And I will continue to promote the profession to the best of my ability. I work alongside some great colleagues. It makes my job enjoyable to come to. I enjoy mentoring and being a leader in various aspects of my job. We've come a long way this year. It's been hard on everybody and challenging. And I thank everybody for everything that they do and all the nurses. And happy Nurses Week.
Thank you very, very much, Sheri. Thanks, Dianne, for supporting yet again this year our joint awards, which is fabulous, for your reflections on the role of RPNs in the system, and Sheri, your contribution and the role you play in advocating for your patients and mentoring your colleagues is truly fantastic. We are so pleased to celebrate today your success. We sincerely thank the winners of the 2nd annual Nursing Now Ontario Awards. Your contributions to the profession make our associations and indeed make nursing overall proud and help us showcase the best of the nursing profession. The 3 award winners of the Nursing Now Awards this year are Aric Rankin, nurse practitioner, Mahoganie Hines, registered nurse, and Sheri Bruder, registered practical nurse. All of you demonstrate excellence in the nomination categories of exemplary nursing practice, resulting in significant client, organizational, and community impact, respectful collaboration with members of the interprofessional team, acting as role models, mentors in supporting others to achieve excellence in one or more domains of nursing, being clinical practice, education, administration, research, or policy, and advancing the nursing voice to strengthen the profession. We thank you all for joining us today on the anniversary of Florence Nightingale's birth and midpoint of our Nursing Week celebration. We still have 2 more days to go. So lots of events put by ONA, by RNAO, by WeRPN. Go to our websites and keep celebrating and enjoying. We know that it has not been an easy year, but more of a reason why collectively we will achieve together many more gains for nursing, and hence the importance of the 3 associations putting this award together. Also more of a reason for you to take 5-10 minutes, whatever you can steal from the day, and do whatever makes you relax and makes you joyful, whether it is to walk in the street, or whether it is to look at the garden, or whether it's to have a glass of red wine with a piece of chocolate, or to hug your child, or whatever, call a friend. We are here for you. We are here to applaud you, to congratulate you, to celebrate you. We thank you all for joining us today again. And as this ceremony comes to an end, let's just recognize our 3 outstanding award winners. Microphones off. Now we need to put the mics on, for their significant contributions to the profession and to the health of Ontarians, with the collective show of applause. Bravo, bravo, bravo. This concludes our ceremony.